Did you know that liver cancer is one of the fastest growing cancer diagnosed worldwide? And yet, many people don't even realize they're at risk until it's too late. In fact, by the time liver cancer shows symptoms, it's often already advanced, making early detection and prevention absolutely crucial. Each year, over 800,000 people worldwide are diagnosed with liver cancer. It is also one of the leading causes of cancer-related deaths globally, responsible for more than 700,000 deaths annually. Today, we're talking about liver cancer, what it is, the causes, risk factors, symptoms, diagnosis, treatment, and most importantly, how you can protect yourself and your loved ones. This is a video you don't want to miss, so stick around as we break it all down. Before we dive into liver cancer, let's first understand what your liver does. The liver is a football-sized organ located under the right side of your abdomen, just beneath the diaphragm and next to your stomach. It performs over 500 essential functions. Among its key roles, the liver balances the chemicals in your blood, produces bile for digestion, clears toxins from the bloodstream, and regulates blood clotting. Most people with cancer in the liver have a type that has spread or metastasized from another part of the body, such as the colon, breast, stomach, or other organs. It's crucial to distinguish this from liver cancer that originates in the liver cells. The treatment for cancer that spreads to the liver is based on the original site where the cancer began. For instance, if cancer starts in the colon and then spreads to the liver, it's referred to as metastatic colon cancer. Like all cancers, liver cancer starts when changes or mutations build up in the DNA of liver cells. When enough mutations accumulate in critical genes, the cells can begin to grow uncontrollably, eventually forming a tumor or mass of cancerous cells that can also disrupt these essential functions. When it comes to liver cancer, most cases actually develop in people who already have some form of liver disease. But what's interesting, and a bit concerning, is that liver cancer can also occur in individuals with no prior liver conditions. And in these cases, the exact cause isn't always clear. Liver disease often leads to prolonged inflammation, which over time can cause mutations in the liver cells. These mutations can eventually lead to cancer. But here's the tricky part. Many people don't even realize they have liver disease until it's progressed to a serious stage, or worse, until it develops into cancer. This is why it's so important to be aware of liver health. The earlier you catch liver issues, the better your chances of preventing severe damage or even cancer. There are several factors that can significantly increase your risk. Let's break down the most important ones. First on the list are chronic infections with hepatitis B or C. These infections are major contributors to liver cancer, responsible for up to 80% of cases worldwide. If you have hepatitis B or C, your risk is much higher. Another key risk factor is cirrhosis. This is a progressive and irreversible condition where scar tissue forms in the liver, severely increasing your chances of developing liver cancer. Unfortunately, once cirrhosis sets in, the damage to the liver is permanent. Certain inherited liver disorders, like hemochromatosis and Wilson's disease, also put you at higher risk. And it doesn't stop there. Diabetes and non-alcoholic fatty liver disease are other conditions that can increase your chances of liver cancer. Exposure to aflatoxins is another risk factor you should be aware of. Aflatoxins are toxic substances produced by molds that grow on crops stored in poor conditions. Grains and nuts can become contaminated, and these toxins can find their way into foods made from these products. Lastly, excessive alcohol consumption over many years can cause irreversible damage to your liver, which also heightens the risk of liver cancer. It's a serious reminder that long-term alcohol abuse can have life-threatening consequences. Understanding these risk factors is crucial in taking steps to protect your liver. By being aware of what increases your risk, you can make informed choices that could ultimately save your life. In the early stages of primary liver cancer, most people don't experience any signs or symptoms. However, when symptoms do appear, they may include unintentional weight loss, loss of appetite, pain in the upper abdomen, nausea and vomiting, general weakness and fatigue, abdominal swelling, jaundice, where the skin and eyes turn yellow, and pale, chalky stools. Other potential symptoms include fever, enlarged veins on the abdomen that are visible through the skin, and unusual bruising or bleeding. If you or someone you know is experiencing these symptoms, it's important to see a healthcare provider as soon as possible. To diagnose liver cancer, doctors use several tests and procedures. Blood tests can reveal abnormalities in liver function, while imaging tests such as ultrasound, Connecticut scans, and MRI are used to get a closer look at the liver. Sometimes it's necessary to remove a piece of liver tissue for laboratory testing in order to make a definitive diagnosis of liver cancer. This is called liver biopsy. Once liver cancer is confirmed, the next step is to determine its stage, which involves assessing the size, location, and whether the cancer has spread. Imaging tests like CT scans, MRIs, and bone scans are often used for staging. Liver cancer can be staged in different ways. One common method uses Roman numerals 1 through 4, while another uses letters A through D. Your doctor will evaluate the stage of your cancer to decide the best treatment options and provide an outlook on your prognosis. Treatment of liver cancer will depend on the stage, your age, and overall health. There are several approaches your doctor can take to help you fight liver cancer. Surgery may be an option to remove the tumor. In some cases, your doctor might suggest surgery to remove the liver cancer along with a small portion of surrounding healthy liver tissue, especially if the tumor is small and your liver is functioning well. Whether this is a viable option depends on the location of the cancer within your liver, the overall health of your liver, and your general health condition. Or in some other cases, doctors may want to remove the entire liver and do a liver transplant. During liver transplant surgery, your diseased liver is removed and replaced with a healthy liver from a donor. Liver transplant surgery is only an option for a small percentage of people with early-stage liver cancer. Treatment might also involve radiation therapy, which uses high-powered energy, such as X-rays and protons, to destroy cancer cells and shrink tumors. This energy is carefully directed at the liver to minimize damage to the surrounding healthy tissue. Chemotherapy, a common treatment, uses powerful drugs to attack and kill cancer cells. Targeted drug therapy, on the other hand, focuses on specific abnormalities within cancer cells. By blocking these abnormalities, targeted treatments can cause cancer cells to die. Let's talk about some crucial steps you can take to reduce your risk of liver cancer, starting with preventing cirrhosis, which is scarring of the liver and a significant risk factor for liver cancer. First, if you drink alcohol, do so in moderation. For women, that means no more than 1 drink a day, and for men, no more than 2. Limiting your alcohol intake can greatly reduce your risk of cirrhosis. Maintaining a healthy weight is also key. If you're at a healthy weight, stick with a balanced diet and regular exercise to maintain it. If you need to lose weight, aim to do so gradually, about 1 to 2 pounds a week, by cutting calories and increasing your physical activity. This can lower your risk of cirrhosis and, by extension, liver cancer. Next, consider getting vaccinated against hepatitis B. The hepatitis B vaccine is available to almost everyone, including infants and older adults, and it significantly reduces the risk of liver cancer by preventing hepatitis B infection. Although there's no vaccine for hepatitis C, you can still take steps to protect yourself. Know the health status of any sexual partner and use condoms if you're uncertain about their health. This reduces the risk of hepatitis C and other sexually transmitted infections. If you use intravenous drugs, avoid sharing needles and always use sterile equipment. Contaminated needles are a common way the hepatitis C virus spreads. Take advantage of needle exchange programs in your area, and if you're struggling with drug use, consider seeking help. When it comes to tattoos or piercings, choose a shop that prioritizes safety. Make sure the needles are properly sterilized and don't hesitate to ask about their procedures. If the staff isn't open to your questions, that's a clear sign to go elsewhere. Finally, if you have hepatitis B or C, seek treatment. Treatments are available, and research shows they can reduce your risk of developing liver cancer. Early intervention can make all the difference. By taking these preventive steps, you can protect your liver and lower your risk of liver cancer. Stay proactive about your health and always consult with your healthcare provider if you have any concerns. Learning that you or a loved one has been diagnosed with cancer is one of the most devastating experiences anyone can face. It's life-changing, and the emotions that come with it can feel overwhelming. But remember, you don't have to go through this alone. There are ways to make this journey a little easier, and it starts with how you choose to cope and find support. First and foremost, being well-informed is empowering. The more you know about liver cancer, the more confident you'll feel when making treatment decisions. Don't hesitate to ask your doctor questions, no matter how big or small they seem. Understanding your options and what lies ahead can give you a sense of control in a situation that often feels uncontrollable. Keeping your friends and family close is another vital part of this journey. They can offer emotional support when you need a shoulder to lean on, and practical help too, like accompanying you to doctor's appointments, helping around the house, or just being there to listen. Sometimes their presence alone can make all the difference, but sometimes it might be hard to open up to those closest to you. That's okay. Finding someone you can talk to, a counselor, a therapist, or even a support group for cancer survivors, can provide a safe space to express what you're going through. Speaking with others who've faced similar challenges can offer comfort, understanding, and a sense of community. Remember, there's no right way to cope with cancer. Everyone's journey is unique, and what works for one person might not work for another. What's important is finding what helps you, whether it's seeking knowledge, leaning on loved ones, or reaching out to others who understand. You're not alone in this, and together we can face these challenges with strength, hope, and courage. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Health Huddle, and hit that notification bell so you don't miss any of our upcoming health tips and information. And if you have any questions or topics you'd like us to cover, drop them in the comments below. Stay healthy, and we'll see you in the next video.